welcome to my channel. This video is another one of the playlist on muscular disorders, and you can find the link on top if you missed any of the previous video. This time I will speak about the hyperkalemic periodic paralysis. That's a form of congenital myotonia that occurs in quarter horses, and it's caused by a mutation of the gene responsible of sodium channels in skeletal muscles. This disorder has been associated with the phenotype of big muscle masses, and it has been described in the descendants of the stallion impressive. What happens in muscles with this mutation? Well, the problem is that these altered sodium channels allow too much sodium to enter the cells while potassium remains outside. As a consequence, the polarization of the muscular fibers are prolonged, causing tremors and weakness. Clinical signs usually appear around 2-3 years of life, and some heterozygotes may remain asymptomatic, while homozygotes have more severe signs and may also show paralysis of upper airway muscles due to severe respiratory obstruction. The acute episodes have a variable duration between 15 and 60 minutes, and after that horses seem completely healthy. Definitive diagnosis can be reached with a genetic test that can be done on whole blood or on hair roots. The histopathology does not show any specific alteration. Sometimes episodes are so quick that they resolve without any treatment, but honey or molasses may help to treat acute signs because the sugar intake will stimulate insulin secretion, and insulin stimulates the uptake of potassium from the cells. If signs are severe and it's not possible to give oral medications, then it can be useful to administer dextrose solution intravenously. Another option is to administer calcium because it increases the threshold potential, so excitability is reduced. If there are signs of upper airway obstruction, it may be necessary to perform an emergency tracheostomy. For long-term management, these horses should receive low potassium diet. Usually they are kept at pasture so that the high water content of fresh grass dilute ingested potassium. It's also important to maintain good exercise programs with regular activity, and for horses with recurrent episodes, despite the dietary changes, it may be indicated the administration of acetazolamide. This drug increases the excretion of potassium through the kidneys and stimulates the secretion of insulin, thus it stabilizes the levels of potassium and glucose in the blood. This disorder can be managed, but horses may present recurrent episodes. They should not be used for reproduction as the disease is transmissible, and it's important to inform the vet of the condition before submit these animals to general anesthesia, because this can provoke one of the episodes. Also, cold and stress may cause the development of acute episodes, thus a careful management is necessary with horses with this condition. Okay, that's all. See you next time. Bye!